Hey, good morning. I'm Vic Senese, and this is UroNurse News. Today we're taking a closer look at one of the most common and most misunderstood health challenges in the world, arthritis, a condition that affects nearly 1 in 5 adults worldwide. Contrary to what many believe, arthritis isn't one single disease. It's actually an umbrella term for a range of conditions that all lead back to the same frustrating outcome. Joint pain, oh boy. A primer from the American Academy of Orthopedic Surgeons offers one of the clearest explanations, breaking down the different forms of arthritis, what causes them, and the treatment paths depending on the underlying issue. It's a solid foundation for anyone trying to understand why their joints hurt and what they can do about it. Now, the most common form by far is osteoarthritis, often described as age-related cartilage loss. This patient-friendly guide from the Up-to-Date walks through what happens when the protective cartilage in our joints begins to break down. That smooth gliding motion between bones disappears and pain takes its place. Symptoms, causes, and today's most evidence-based treatments are all outlined in language anyone can understand, making it an ideal resource for patients. Here's a fascinating twist. In a debate over chronic arthritis, whether we should keep joints active or protect them from overuse, scientists looked outside the human population for answers. And they landed on all things kangaroos. According to a reporting from Vice, kangaroos have exceptionally thick knee cartilage, allowing them to absorb massive impact without developing the kind of arthritis we see in humans. Humans, why aren't we so lucky? Well, osteoarthritis is wear and tear. Rheumatoid arthritis, or RA, is something very different. An autoimmune condition, RA affects about 1% of the population. Now, the body's own immune system attacks the joints, leading to inflammation, pain, and progressive damage. A comprehensive update from the NIH breaks down what's happening at the cellular level, how RA is diagnosed, and the expanding lineup of medications that can help control this debilitating condition. Doctors still don't know exactly what's causing RA, but new research is pointing to an intriguing direction, the gut biome. We're learning more and more about that, folks. An article from The Atlantic highlights emerging research showing that chemicals produced by bacteria in our intestines might influence the development of rheumatoid arthritis. It's a frontier that could reshape how we diagnose and eventually prevent RA in the future. With nearly 350 million people worldwide affected by arthritis, research efforts are accelerating. A report from Labiotech outlines 5 promising recent advancements from biologic medications to new imaging technologies and emerging anti-inflammatory compounds. Now, these aren't cures, at least not yet, but they're meaningful steps forward. Perhaps the most exciting frontier lies in what we call the holy grail of arthritis treatment: regenerating healthy cartilage inside our joints. The New Yorker explores how researchers are studying organs like the liver and even fingertip regrowth to understand how the body repairs itself. If scientists can unlock the same regenerative pathways for cartilage, could change the future of arthritis care entirely. Hey, a groundbreaking study is raising serious questions about something millions of people live with every day: tattoo ink. New evidence shows that pigment doesn't just stay in the skin. It travels through the body, kills key immune cells, and may even weaken your vaccine response. What does this mean for your health? Which ink colors pose the biggest risk? And should patients with chronic conditions think twice before getting that tattoo on their skin? Don't miss tomorrow's episode to learn more about that in UroNurse News. Well, arthritis affects millions, but thanks to ongoing research from kangaroo joints to gut bacteria to regenerative biology, we're inching closer to better treatments and perhaps one day real cures. I'm Vic Senese. Thanks for joining me. And of course, stay informed, stay healthy, and like and subscribe.
Deck the halls with updates and cheer. Trusted insights throughout the year.